I'm going to read passages from the Hunt itself on structural dissociation. This chapter is on tertiary structural dissociation, which is most commonly associated with DID. Tertiary structural dissociation involves not only more than one emotional part of the personality, aka EP, but also more than one apparently normal part, aka ANP. The DSM-4 diagnostic category of DID is limited in its description of identities or personality states. It states that each personality state may be experienced as if it has distinct personal history, self-image, and identity, including a separate name. However, in our clinical practice, we often encounter parts of the personality in DID patients, in particular some EPs, that do not have a name or other strongly defining characteristics. In DID, there is a requirement for amnesia and for alternation between at least two identities, but the range and characteristics of dissociative identities are not specified. Furthermore, the DSM-4 discerns different types of dissociative parts of the personality in terms of being passive, dependent, guilty, depressed, hostile, and controlling, but does not describe how dissociative identities of patients with DID differ from those of patients with DDNOS, which is dissociative disorder not otherwise specified. On a clinical level, therapists have tended to use the diagnosis of DDNOS when the emancipation and elaboration of dissociative parts of the personality are limited, although the DSM-4 offers no guidance. We propose that secondary and tertiary dissociation differ along several lines. In secondary dissociation and DDNOS, there are less profound amnesic boundaries among the parts of the personality. ANP is by far the most extensive part of the personality, the majority shareholder. EPs tend to emerge in daily life less often and tend not to be mediated by the action systems of daily life. Thus, EPs in secondary structural dissociation are more likely to be mediated by defense only, and there is more tendency to have only a single ANP. When EPs emerge in daily life, it is usually related to reliving a traumatic memory or because there is a stimulus that evokes a part's defensive function. For example, a survivor may have an EP that emerges to fight with a partner whenever sex is initiated, as they perceive it as rape. These parts generally have limited functions and often do not have full awareness of the present. In principle, the number of parts of the personality in a given individual has little bearing on whether dissociation is at the secondary or tertiary level. A patient with secondary structural dissociation may have many EPs, while a patient with tertiary structural dissociation may only have 2 ANPs and 2 EPs. However, in general, more divisions relate to less mental efficiency and more likelihood that a traumatized individual will have tertiary structural dissociation. Patients with tertiary structural dissociation encompass 2 or more parts of the personality that engage in functions of daily life. These ANPs are activated by the individual's need to engage in particular activities of daily functioning, rather than being evoked by reminders of traumatic memories. For example, some parts are focused only on work, some on being a parent, some on sexual activity. We hypothesize that the origins of the divisions among ANPs lie in the inability of an unsupported, emotionally neglected, and abused child to integrate emerging action systems of daily life when various aspects of daily life themselves are chronically traumatizing. New quote. In very low-functioning DID patients, many ANPs and EPs may seem to be virtually indistinguishable from each other. However, on closer scrutiny, some dissociative parts, ANP-based, appear to be more oriented to function in daily life, while other parts, EP-based, may seem more oriented to defense. The next part that I'm going to do from this book will go into host parts and child parts.